Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today are the basics of disc bulges and disc herniations. The normal intervertebral disc contains a remarkable 80% water, and the other 20% is proteins and various collagens. There are two areas of the disc. The outer portion is called the annulus fibrosus. This has nerve endings and can actually feel pain. The inner part is a gelatinous section called the nucleus pulposus, and it has no nerve endings and cannot feel any pain. The disc overall acts as an excellent shock absorber. As we walk and jump and everything, water routinely gets squished out as the disc is compressed, and then water comes back in. As disc degeneration occurs, it's most commonly between the ages of 20s and 50s, and it's due to a number of factors. Risk factors such as obesity, smoking, repetitive trauma, like if you're a truck driver for years and years. Genetics has a big part, and then social and environmental factors, which are not very well understood. And this leads to loss of fluid in your disc. Think of it as a tire that's losing air, but in this case it's fluid, water. Loss of height in the discs as a result of the fluid going out, and then tiny tears or cracks in the annulus. Remember, the annulus is the outer part of the disc that actually has nerve endings and can feel pain. So when you start to lose the fluid, when you lose the air from the tire, so to speak, you get a loss of height and bulging. And you can see that this is looking at the spine from the side on an MRI. This is a normal disc up here. This is a degenerative disc that's bulging, and it's bulging backwards. Interestingly enough, 35% of those between the ages of 20 and 40 have evidence of degenerative disc disease on MRI and no back pain at all. So it doesn't mean it's going to be an exceptionally painful situation. A disc herniation is when if a tear occurs in the annulus, the outer part of the disc, it can cause considerable back pain, okay, because of the nerve endings that are there, and they may get inflamed. Now, if the tear is large enough, some of the inner part of the disc, the nucleus pulposus, can squeeze out. It's like the jelly squeezing out of a donut, okay? And there are a bunch of names for this: slip disc, herniated nucleus pulposus, prolapsed intervertebral disc, herniated intervertebral disc, whatever you want to call it, it's the same thing, okay? You start to get a bulge here, you can get a tear, and then the disc herniates out. So that's what we're talking about. Well, what are the symptoms of a disc bulge and herniation? First of all, there may be no symptoms at all. All right, it's not necessarily going to cause you pain. If you have a disc bulge, the symptoms may include back pain. That you can also get sciatica if the irritation from that tear in the bulge is leading to inflammation in the area. You can have spasms and aching. A disc herniation can cause burning, searing pain as it pushes on a nerve root and inflames it. It can cause pins and needles and numbness throughout the distribution of where that nerve root goes. It can cause motor weakness, and then rarely you get incontinence. Treatment of a disc bulge and herniation, you may not need any treatment, and that's called benign neglect, where you just kind of watch it and see, just watch and wait. Over-the-counter medications such as anti-inflammatories and Tylenol may be helpful. Physical therapy can be exceptionally helpful. Chiropractic treatment such as spinal manipulations. There is a revolutionary treatment called spinal decompression therapy that involves intermittent spinal traction, and that was FDA cleared back in the late 90s, and it's really popular now because it's non-invasive, very safe, outpatient. And then prescription medications such as a Medrol dose pack, which is about a 5-day course of prednisone, should only be done once in a blue moon. Narcotics and non-narcotic medications, muscle relaxers, neuropathic medications, and then topical pain creams. Interventional treatments may include trigger point injections to help with the spasms and aching, intradiscal injections, and this may include steroid. There's actually a study showing that months of pain relief can occur from that. And then if you're having leg pain due to the inflammation or compression of the nerve root, as you see here, you can do an epidural injection which bathes this area in steroid, soothing steroid and numbing medicine. Well, what are the outcomes? Over 75% of individuals with either degenerative discs or symptoms are able to avoid the need for surgery. Out of those with sciatica symptoms, because the nerve is pinched or irritation from annular tear, over 95% are able to avoid the need for surgery and obtain satisfactory pain relief. There was a landmark study back in 2006 in the Journal of American Medical Association looking at disc herniations that were operated on or those that were not operated on, and after a year, the outcome was the same. Now, going back here 1 second, it's very important to note that when I talk about the incontinence, that's a surgical emergency. So if someone were to have that, you need to be seen right away. Not a week later, but immediately. Okay? Most of the time, though, sciatica can be treated as an outpatient in a non-emergent type of fashion. That's the one thing to watch out for. Colorado Pain is the top comprehensive pain management in the Metro Denver area with additional clinic locations in Buena Vista and South Granby. The clinics accept over 50 insurances with the board-certified pain management doctors offering both medical and interventional treatments. They're award-winning. They've won the Patient's Choice Award 5 years in a row. Accept workers' comp, personal injury liens, also self-pay. The number to call for treatment is 720-306-9575 and visit us on the web at painmanagementdenverco.com. I'm Dr. David Green, CEO of the Colorado Pain Network. Your pain stops here.